In summary, everything I've talked about, you need to focus on your existing patients. You need to think about how you are communicating with them and what needs to be improved. Make sure that you pick your marketing carefully. What's right for you, what's right for your practice, what's right for your budget. If you're going to do something, be consistent. So everything I've talked about requires consistency. There's no point in you trying to do one email newsletter, social media, a bit of a referral program. You need to be consistent. You need to have your goals. You need to set review points. You need to regularly review your numbers. And you need to make sure that you're getting the right advice from the right people. So how can we help? So we can help practice in any stage of their practice growth. So we can help a practice with their foundations, branding or rebranding, the websites, things that we consider the basics. You know, your collateral, your referral programs, okay? Everything that needs to be in place is a basic. Patient attraction, most practices need new patients. We can help with your online advertising, Google optimization, your marketing campaigns, print advertising, public relations if you're that size. Patient retention, everything we've talked about today. So your patient communication, your social media, your email newsletters, print newsletters, promotions. So we can work with the practice and get all of these in place. And we can also work with practices on a consulting side and a coaching side. So if you don't know what's working and need help in getting things planned and in place and your team on board, we can work with a practice to make sure that you've got strategic practice marketing in place, goals and measurements. And I just want to talk about the Social Dentist, which is our new social media product. And this is for practices that are struggling with their content. Don't know what to post, don't know how to post, don't know when to post. You haven't got the time. You might be the person that likes quotes and was going to spend 3 weeks to get some quotes put together. Okay? Or you might be the person that's scared about putting the wrong type of message in it, affecting your brand. So what we do is we do it for you. So we will post 5 days a week for you. You don't have to think about the mix because we have thought about it for you. So we will make sure that you've got the right mix to engage your existing patients, to educate your patients. We do it in advance. We do it 3 months in advance, so you just have to check things off and know that it's all been done for you. It's branded, it's got your images in there, it's got your links back to your website, everything that I've talked about. We use trusted news sites for information and education, and then you get a quarterly call to check in with your consultant to see how things are going. So it has minimal time and minimal effort from you guys, because I believe you've got much better things to do with your time and your money than to go looking for quotes and create them yourself. And it's all been done for you. So there's a couple of clients that are doing this and a couple of testimonials. So for Greg, it was the pressure of knowing that he had to do it and the relief that this is just going for him in the background. And for Trent, he didn't know what the mix was, he didn't know where to begin, he didn't know where to start, and he just wanted someone to take the pain away. So the pricing is $599 to set this up, and then an ongoing fee of $349 per month. But the seminar special is that we will clear the setup free. So for anybody that's interested in signing up, fill in the form and you will have a reduced setup fee. So if you want to know more, you can have a chat with me. We've got some more information. Susie's in the back as well. If you want to know anything more about our services, please fill in the form. And because we love feedback It's really important for me because when I go back home tonight, I'll sit and I'll read your feedback forms. So if you could write something, that would be great. And the final one, and a favour from me, is can I take a photograph of you guys? Because of course it's all about marketing, it's all about social media, so I have to have a little friendly photo of you guys looking like you've had the time of your life, so I can put it on my social media channel. If you are shy, put a piece of paper in front of your head or duck behind the person behind you, and this is where I have to hide behind the wall. Okay. Alright, so you have to wave and look like you've had the best night of your life. Come on, waving, because Brisbane are always really, really excited by my presentations. Okay, so thank you so much for your time.
Thank you.
I've got 10 minutes or so to take any questions.
The question on your package and what you provide for social media, do you use just generic images, or do you come into our practices and take personalised images?
So what we do is practices that have got professional photography, will use your professional photography. Practices that don't, will use stock images. That's for the branded images.
How many images do we have?
And
everyone's got them.
yeah. So most of our practices that we work with will have a photographer.
Yeah.
So
So
we
you're just
will work.
using their bank.
Yeah, absolutely. So most practices will have photography nowadays.
And you can post around those.
Correct. And what we also do is we get you to take photos yourself. So the relaxed ones look like they've been posted that day.
So they just feed through to you guys anyway.
Yeah, so you just feed us. So we will say, approve this quote, approve this, tell us your statements. So we do all the legwork. We will then create in advance, publish in advance. We will say, okay, you've now got to take 13 photos of you and your team around the practice, and lo and behold, it looks like it's been taken that day. Yeah, absolutely. So we've done the work, we've done the research, we feed it to you, you approve, and then it's done. And it's what we do with our marketing. Everything is there. You know, people say to me, "Oh, you're all over LinkedIn." It's like, no, I'm not. I'm not at all. It's all been done and approved in advance. Apart from today, where I will be all over. So. Any other questions? All good? Thank you for your time, and apologies about the late start. I hope you've got some good information.